Great. So once again, this is a joint information session between our residential admissions team and our online admissions team. I'll kick off introductions. My name is Elise Rudolph. I'm the Director of Online Recruitment and Admissions with our School of Public Health. And I'll pass it over to my colleague, Derek. Would you like to introduce yourself?
I sure would. Thank you, Elise, and welcome everyone. Um, Good evening, good morning, good early morning, depending on where you are. Wherever you are, we're happy that you're here. My name is Derek Bynum. My pronouns are he, him, his, and I am the director of the residential admissions and recruitment team. Residential admissions being basically um, it's the on-ground MPH program. With that, I am going to pass it on over to Stephanie.
Thank you so much and welcome everyone. I'm super excited that you're here. I'm Stephanie Nguyen, pronouns she, her, and I am the online education recruitment manager for the program. So I work really closely with Elise. We are your online MPH admissions team, supporting you with learning more about the program, the admissions process. So if you do have any questions at the end of the session specific to the online program, do reach out. We are your team, and I'm happy to pass this along to my wonderful colleague, Lori.
Thank you, Stephanie. Hi, everyone. I'm so excited to have you all in the space. My name is Lori Nalbandian. I use the she, her pronouns, and I am your in-residence admissions and recruitment manager here at the School of Public Health. And Derek and I are your on-campus or in-residence admissions team. So we're here to answer any questions that you have related to our residential programs. And we're so excited to have you in this shared space. And last but not least, I want to turn things over to my wonderful colleague, Yesenia.
Hello, everyone. Buenas noches, días, tardes, wherever you are. Welcome to this session. My name is Yesenia Mercado. I use the she, her, ella pronouns, and I am the Student Funding and Admissions Manager for the School of Public Health.
Wonderful. Well, again, we all are incredibly grateful that you've carved some time out of your day to spend with us. We hope that this is an informative session and hopefully we get all of your questions answered. So to kick things off, we'll be going over Berkeley Public Health's mission, vision, and values. So we want to share a little bit more with you about who we are as a school and as a larger learning community. Then we're going to talk about the various concentrations that we offer, the different programs that you can pursue here. We'll talk about the various admissions timelines. So our online program and our on-campus programs offer different timelines and different application periods. So we'll go over those with you. And then we'll talk about tuition, program fees, and funding. Again, we're so grateful to have Yesenia on to talk about specifics around financial aid. And we'll open things up for Q&A at the end. All right.
Awesome. So I will go over the I want to just kind of go over and highlight the mission, vision, and values for UC Berkeley, specifically UC Berkeley School of Public Health, and then kind of what makes us us in terms of the world of public health programs. And so one of the main, or one of the, I should say, one of the first I guess things I want to highlight in terms of what makes Berkeley Public Health, uh, who we are, is we look at health as a right. It's when you interweave health and social justice, essentially that's kind of one of the aspects that you get when you look at public health. But we do believe in social health. I'm sorry, social justice and the basic human right to a healthy life. We want to make sure that our students know that that they're striving to minimize any inequities, any injustices that tend to affect health and the dignity of different people, different populations, and especially populations that are the most vulnerable. Okay. We look at strength, and we look at strength specifically through diversity. That's where we derive our strength, is through diversity. I know that diversity, DEI, things like that are under fire nowadays. They're buzzwords and many people kind of throw them around, not necessarily always understanding what they mean or how they factor into, daily life. But we do. And not only that, but we welcome diversity. We see the value in diversity, not only in education, not only in research, but just in service, just in general. Whenever we're embracing diversity, that's usually the best way to kind of successfully engage, transform, and come up with solutions to problems. And so we definitely look at and value strength, especially when we are looking at it through the lens of diversity and how those are interwoven. Okay. Um, Another value of UC Berkeley School of Public Health is being forward thinking, thinking forward. We're looking to make sure that our students have innovation in mind. They're looking to lead innovation. Um, sometimes, especially nowadays, it can be a little difficult to say that, our culture challenges conventional thinking. And I think that we make sure that we are actually doing that. And by things like leveraging technology, building bridges between populations, building bridges with research, really working with and influencing public policy, education, and then taking action. I think those are all kind of the ingredients in making sure that Berkeley is forward thinking and that we are training our students to be forward thinking as well. And, in tandem with that is, looking at impact. What impact does, a policy have? What impact does a practice have? What impact does research have? What impact does education? What impact does that action that we were talking about? What impact does that have on the populations locally and globally? And how are we making sure that we are honoring our commitment to maximizing impact, by making sure our students are focused on, things like research, education, and service in service of populations. And so those are really kind of like the core vision, and I would say core values that make Berkeley Public Health what it is. And with that, I am going to pass it over to my colleague Elise to go over the mission of UC Berkeley.
Awesome. Thank you, Derek. Yeah, so our mission here at the School of Public Health is to improve population health, especially for the most vulnerable, through a variety of means. So we do that through radical collaboration, preeminent education, and transformational research. So Derek already covered a lot of this, but one thing I'll highlight here is that we're here representing all of the on-campus programs that you can pursue and the online options. And I really want to express that this mission, vision, values that we're sharing are true for all of our programs. This is really who we are as a school, and you'll see all of these things kind of woven through the curriculum of all of the programs and really the educational experience that we aim to offer. So, you'll see radical collaboration between online students, on-campus students. You'll see really the quality of the education that we offer. I mean, it is a UC Berkeley education, regardless of whether you're doing an on-campus program or an online program. And we really have incredible students and faculty who are participating in research that is influencing public health policy, public health practice every day that our students and faculty are producing. So we're really proud to share more about what we have to offer tonight.
Wonderful. Thank you so much to both Derek and Yesenia, Derek and Elise, excuse me, for giving such a wonderful overview of our amazing community here at the School of Public Health, one that I know I'm very grateful to be a part of. And hopefully you all will find a place here, whether it's through our online program or through our residential program as well. So let's go ahead and dive right into some of our information related to our residential programs and the different concentrations that we offer here. So within our School of Public Health, and specifically our residential program or on-campus program, you'll hear those terms being used interchangeably throughout this session. Our two most popular programs that I'll say that we have here are our 2-year Masters of Public Health program and our 11-month and 4+1 Masters of Public Health program. So our 2-year Masters of Public Health is our most popular, and we offer a variety of different concentrations, including epidemiology, biostatistics, health and social behavior, different community health sciences concentrations, infectious diseases and vaccinology, health policy and management, and the list goes on. Within all of those concentrations, it is a 2-year program, so 4 semesters. We are a semester-based school here at UC Berkeley. 4 semesters for that 2-year Masters of Public Health program. We also offer an 11-month Masters of Public Health program for our individuals who hold some type of professional level degree already. So this may be an MD, a PharmD, or even a JD, some level of a professional degree. And those concentrations are epidemiology, food nutrition, maternal health, and interdisciplinary. We have paused our health policy and management concentration starting for the fall 2025 semester moving forward. It is undetermined whether that program will reopen, but for our fall 2025 and fall 2026 admission cycle, it is paused. We also offer for our current undergrad students who are pursuing a public health degree here at UC Berkeley, a 4+1 master's program. And these are available in 3 concentrations, epibiostatistics, food nutrition, and maternal health. And we also offer a variety of concurrent MPH programs. So these are dual degree programs with other schools within UC Berkeley, including a master's with our School of Public Policy, School of Journalism, City Planning, Social Welfare, and Business Administration. And we also offer an MA and MS programs, as well as joint programs with UCSF for an MD and MS program. Next slide, please. I'll turn things over to Stephanie to share a little bit more about our online program.
Thank you so much, Lori. So within our online MPH program, we have 4 specific concentrations that we offer. So if you are a student that is looking to have a healthy work-life balance, the online program will offer a part-time program specifically offering these 4 concentrations here. So our website will have a deep dive in terms of the specific details about the program, but I'd like to highlight that the interdisciplinary concentration offers 3 specific tracks within it: community health sciences, spatial data sciences, and global health. But also for students that may not see a particular concentration such as maternal, child, adolescent health, but still would like to consider the online program, definitely reach out to me and we can discuss how you can incorporate that through an interdisciplinary plan. The other options that we offer are health policy and management. And what's unique about this particular concentration is that there is a health management certificate embedded in your required coursework. So you would be able to obtain a health management certificate in addition to the health policy and management. And there's other ways to still obtain that certificate through your elective courses in our program as well. So one of the unique things that I'd like to point out, we also have epidemiology and biostatistics and food and nutrition and population health. But again, if you don't see something that we offer in our program, I would advise to reach out to me so we can see if our program might be suitable if there are work constraints and you still want to pursue your MPH through our program. So I'm going to take a deeper dive into the program design here. So the type of degree that our online program would offer you is a professional degree. So this is used for applying your coursework into the work that you're doing. So very hands-on type of training and degree. The duration of our program is 27 months. So it's a 7-semester program, part-time, we're semester-based, so there is rigor to it, but it's definitely balanced and intended for those that have a, again, full schedule and just a heavy load in their outside responsibilities. The units for graduation are 42 minimum units. The modality of our instruction is 90% online, which is asynchronous. That means that you are not required to be online at a specific time. Our lectures are typically done through pre-recorded lectures, But I will say that there are a lot of opportunities for synchronous engagement. So this could be through our weekly office hours that our faculty hold, or in some of our classes, we have also designed additional opportunities like a journal club for students to meet in real time through Zoom. The other mandatory 10% component of our program is in person, actually. So there are 2 mandatory campus visits. They are held 1 each summer, and they are 4 to 6 consecutive days per visit. So to give you a quick overview of what this would mean is that we take the online learning environment and we move it into in-person for 1 week. So this gives you the opportunity to meet your faculty, to connect and network with your peers, your cohort, and there's a connection to the courses that you would be taking. And it just gives a full, well-rounded experience here. So the weekly commitment that our students would spend in our program, and this includes all coursework, all responsibilities in relation to your academic responsibilities, I would say average out to 15 to 17 hours per week on your course assignments. Our program, even though it's an online program, we do require a practicum. So this is under the guidance of a preceptor. It's a minimum of 130 hours, and the average duration of the practicum is typically 3 to 4 months of completion. So happy to talk about this a little bit further, but I'm going to take us to the next slide and send this back to the residential admissions team to cover the admissions timeline and requirements.
Awesome. Thank you. Thank you, Stephanie. So, so as I mentioned before, the difference between online and residential being on ground. So there might be, whether you're someone that knows which program you want to go into, or if you're someone that's, kind of on the fence and vacillating between the two, I wanted to make sure that we go over the residential MPH admissions prereqs. And so one of the, or basically like the 3 really important kind of prerequisites are that our applicants have a bachelor's degree or from a recognized, or I should say, have a bachelor's degree or a recognized equivalent from an accredited institution. Okay. Um, Statistics or college level math earning a better grade of B plus or higher is also a prerequisite, as is a minimum GPA of 3.0. And we'll kind of get into the nuance of that in a second. But yeah, so these are the main prereqs for any applicant looking to apply specifically to the residential MPH programs. Now, for any student that is that's applying with a bachelor's degree from the US or an English Canadian bachelor's degree, you will need to make sure that you submit your SOFAS application and fee through the SOFAS website. That's where most or many schools of public health have their application through that centralized service, which is known as SOFAS. So your SOFAS application and fee is required unless you have a fee waiver. Their UC Berkeley graduate application is also required. Now, the UC Berkeley grad application for anyone applying to the MPH program it's a little different, but follow me, stay with me. So if you are an applicant that's applying to an MPH program, you will need to first submit your SOFAS application, your completed SOFAS application, and pay your fee. Once you've completed your SOFAS application, submitted it, and paid the fee associated with your SOFAS application, then you will go and you will be sent information and a link to your UC Berkeley graduate application, in which you follow that link, follow the directions in that link, and you set up your account or your application in your UC Berkeley grad app, and then you pay your fee for your UC Berkeley grad application. So essentially, it's 2 applications that you're going to be submitting. The great thing is that you don't have to worry about actually manually filling out both applications. As an applicant to the MPH programs, all you need to do is complete your SOFAS application, and all the information and materials that you submit in SOFAS will automatically be copied and carried over into your UC Berkeley grad application. So you know, we make it, we can't make it too easy, but we do make it a little bit easier. So, so that is, that's like the two like main things, and that's for applicants with a U.S. or an English Canadian bachelor's degree, or an international one. But I'm getting ahead of myself, so I'm gonna stick back to the checklist. So, in addition to those two requirements, you'll also need your CV or resume, your statement of purpose, your personal history statement. Now, those two things sound the same, and many times they're conflated or used interchangeably, but they are very different, and we'll get into those two, the difference between those two materials in a second. You'll need a minimum of 3 letters of recommendation. You'll need to make sure that you include and send all of your official transcripts from each institution you have attended, whether you've gone to NYU, and then one summer you took archery at a community college for a summer course, or just to, you know, get a workout in. You'll need to make sure that you send all your transcripts, even that one school that you took archery from some random term. Okay. I don't know why I always use archery. It's pretty random, but I think I just use it to drive the point home. But hopefully I did drive the point home, which is every school, every college that you attend, you will need to send your official transcripts from that college. University, college, or community college, it does not matter. You will need to make sure to send all your transcripts, official transcripts, from each school you've attended. In addition to that, for certain programs, the GRE is a requirement. Most of our programs, it's optional, so you don't necessarily need to worry about submitting GRE scores, depending on your program, but you'll want to make sure that your program, that you know whether it's optional or required for the program of interest for you, as well as a writing sample. Now we'll get into that in a second, but you know, journals, any journals, any articles, any you know pieces of writing, essays, what have you. If it's applicable if it's applicable and required for your program, then you will need to admit it. But most of our programs it's not a requirement. Now, for any applicant that has gotten their bachelor's degree from a non-US and non-English Canadian non-English speaking in university, then there are a couple of additional requirements that are required. So you will need to make sure that you submit your West evaluation. This is for international transcripts, and make sure that's sent to SOFAS. So if you have any international transcripts, you'll want to make sure that you also submit those through SOFAS. Any transcripts or degree certificates from each institution you've attended that's, you know, work in keeping. It's the same as the requirements for, you know, any applicant with a U.S. or English Canadian bachelor's degree. And lastly, your official TOEFL or IELTS or IELTS score is also required if you are a student that received their bachelor's degree from outside the U.S. and as a non-English speaking Canadian bachelor's degree. Okay. And I will hand this back over. We're doing a lot of passing back and forth. I will hand it back over to Elise.
Awesome. Thanks, Derek. Yeah, so I mean, really, the online application process is very similar to what Derek just detailed. We also use the UC Berkeley graduate application. So we're going to have the same prerequisites, which are, you know, campus-wide graduate application prerequisites for all UC Berkeley graduate applicants. We also require a CV resume, the 2 essays that Derek mentioned, 3 letters of recommendation, and transcripts from every institution you've attended. The most important distinction between our 2 application processes is that the online MPH program does not require SOFAS. And in fact, we do not accept SOFAS applicants. So please, you know, if you're looking to apply for the online program, you only need to do the UC Berkeley graduate application, not SOFAS. And also, it's important to note that the UC Berkeley graduate application will only let you have 1 application active in a given application cycle. So it is important that you think through and decide whether or not you would like to apply for one of the on-campus or residential programs that Derek and Lori went over, or if you're interested in applying to the online Masters in Public Health program, because you will need to choose just one of those to apply to. Yeah, but otherwise, same things. GRE is optional. We also don't require a writing sample, but we do have a preference for 2 years of prior work experience for our online program. So those are going to be the key distinctions. All right, hand it back to Derek.
Oh, back to me already? All right, let's
Back to
go.
you already.
And so and I think a really good way to kind of be able to kind of conceptualize all this, is through time. I think a timeline always kind of helps folks to organize their life and their schedule of getting their materials ready. So when the time comes to apply, you're not scrambling at the last minute trying to get everything in, because we all know haste makes waste. And oftentimes, like when we're rushing and doing stuff, that's when we're going to probably make the most mistakes. And so I just wanted to have and present like this kind of timeline so that you can um, really conceptualize and really get a good idea of, like, okay, we're in July right now. What do I need to be doing? We're in August right now. What do I need to do by the end of August? What do I need to do by all these times? So we're gonna kind of go over that timeline leading up to and shortly thereafter, depending on if it applies to you, the application or priority application deadline, because that's like the most important thing. That's like the thing that everybody should have like circled like 5 times with like highlighter and stars all over in their well, old school planner, if any of y'all have it, but especially on your Google Calendar, like color code it and everything. December 1st is like the date to remember. So we're gonna work not backwards. We're gonna work forwards towards December 1st. So for anyone that's looking to apply to specifically our residential MPH program, mid-August is when you want to mark your first, or when you want to make your first mark in your calendar, because that is when our SoFast application actually opens. I believe August 13th is the date this year. And so if you're looking to apply for our residential MPH admissions, I'm sorry, MPH program, any of our programs, then it becomes available for you to start on August 13th, which is, can't believe it's about a month away already. And so, obviously you want to make sure that once you start, you know, you choose the schools that you're looking to apply to, with Berkeley being one of them, and you start filling out your application. My recommendation, I'm going to say this now, and I'm probably going to say it again before we're done. Um, the sooner you start on your application, the easier this will be. It's going to be a little bit more time, but if if you spread it out, it's going to be much more manageable than trying to do everything in the last week. So mid-August is when you want to mark your calendars for the opening of the SoFast application. Um, it does cost $150 to apply for their first program, and I think $60 for any additional program after that. And so, like, excuse me, like I believe it was Stephanie, or at least like our online admissions team mentioned in the slides before, you can only apply to one program. So we don't want to necessarily, we want to make sure that not to apply to like our program and then another program, because it's going to be messy, and then we're basically going to get a notification saying, hey, pick one. But yeah, so you only apply to one program. So the SoFast applications opens in mid-August. Then about 3 weeks, usually it's about 3.5 weeks later, our UC Berkeley grad application opens. And so once you're done, once you've submitted your SoFast application and paid the fee or had the fee waiver, then you'll want to make sure that you mark your calendar for mid-September, because that's when the UC Berkeley grad app opens. Once your UC Berkeley grad app opens, that's the time for you to go in, follow the link, create the account for your application, or excuse me, and then pay your UC Berkeley grad app fee. I can't stress enough, pay your UC Berkeley grad app fee. If you're not paying out of your own pocket, make sure, if you're eligible for the fee waiver, to make sure that you request that waiver well ahead of the deadline. I can't tell you how many times we have like a pile of applicants. They might be qualified, we're not sure, because we don't really review them, that we don't really review incomplete applications, and no one's application is incomplete if they have not paid or submitted their fee waiver. So make sure that you not only submit your application, but you pay and or get your fee waiver before, as soon as possible. And yeah, so, but again, like I said, you have to submit your SOFAST before your UC Berkeley grad app. But once you've done both, hopefully well before December 1st, by December 1st is when you submit your application. Now, I did want to point out that Monday, December 1st is our priority application deadline this year. And you want to make sure that you're submitting your application by 11:59 p.m. Eastern time, which is 8:59 p.m. Pacific time. Please write that down and make a note of that. In my time as working in admissions, both here and elsewhere, I've had so many people who they read the time and they say, "Oh, I got it in by 11:59," but they're here on the West Coast and they submitted it at 11:59 p.m. Pacific time, which meant technically they submitted it after the deadline. And so don't want to be in that boat. You don't want to be in that situation. You want to make sure that you get everything in by or before the deadline. Okay. Now, for those that apply for the, most of our programs just have the one priority deadline, which is December 1st this year. We do have a couple of programs. I believe it's the interdisciplinary 11-month MPH, as well as the food, nutrition, and population health, both the 11-month and the 2-year MPH programs. These programs, these concentrations also have a second application deadline, and this year it's going to be March 2nd, 2026. Okay, so if you're applying to any other program besides these listed here under the March 2nd date, then December 1st is your date. Okay, but if you're applying to interdisciplinary or FNPH, then you can either submit your application by the December 1st priority deadline, or if you need more time, or what have you, you will have until March 2nd to submit for the second application deadline for these specified programs. Okay. So what happens is once the December 1st deadline closes, we gather all of our applications and everything. We don't start reading or reviewing applications until after the deadline. So just to let you know, it's not rolling applications or rolling admissions. We don't start reviewing until after the deadline is closed. Okay. So after the deadline is closed, realistically, it's December 1st. We're leading up to the holidays. We do reach out to people if we need to and everything. But we don't start really reviewing until the new year when we come back in January. Okay, and it's a big task, but it's a task of love because we do what we love, and we do it because you guys have worked so hard that anything else would be uncivilized. So once the review cycle or season is done, and that's usually around the end of January into the beginning of February, is when application decisions become released. And so students start getting the notifications of whether they've been admitted or not. Okay. And so we usually send out those decisions around late February. Usually late February at the latest. Usually it's early to mid-February for the most part, but we do send out admission decisions as soon as they become available. And most of the time it's by or before late February to give you guys time to weigh your options, figure out which is the best fit for you, and make your decision as well. Okay, and I'm going to hand it right back to Elise.
Thank you. Thank you. So we'll talk about our online MPH admissions timeline. So another unique feature between the on-campus programs and our online programs are that our online MPH offers a spring admission term. So we do admit students to begin the program every January and every fall in August. So our on-campus programs are just going to be that fall start, but you have spring or fall options with online. If you're interested in applying for kind of that traditional fall start, we have a priority and a final deadline. Our priority deadline to apply for the online MPH for fall is January 5th. And we have a March 2nd deadline as well. So a little bit later on in the spring. So again, our priority applicants will begin reviewing those as soon as they're submitted on January 5th. If you choose to apply by the priority deadline, you receive your admissions decision about 2 months earlier, which is really nice for planning and preparing, since we know adding school onto your work and other responsibilities is a big life change. So we do encourage folks applying by the priority deadline. But if not, again, you have until March 2nd to apply for our fall 26 cohort. And for those applying by the final deadline, admissions decisions are released usually in late May, and that would be to start the program in August. All right, so we're going to dig into some specifics on how to create a strong application. We want to give you some tools to put your best foot forward regardless of what program you're applying to. So really all the tips that we're going to share are applicable regardless of your program. And we hope that these are useful and can give you some clarity, because we know this is a big and sometimes daunting process applying to grad school. All right, I'll kick it off. I think Derek is taking the next slide.
Yeah, we're just playing ping pong at this point.
We are.
So as Lisa mentioned, being and making yourself a strong applicant, is more than just your coursework that you've taken and the GPA you've gotten. It's really taking the process, breaking it up and giving yourself time. I think that's like the best advice, and I would say the best universal advice that you can give any person that's looking to apply to any program. Is just to really break it up into pieces, and give yourself time. So in order to kind of give yourself, if you're applying for the residential or on-campus programs, in order, give yourself a good start to the whole application process is, first, you want to make sure that you know what the admission requirements are, not only for just the basic admission, but also for your program and concentration specific qualifications. Okay, so when you go into your SOFAS application, when you pick your concentration of choice, you want to make sure that you read everything and read everything carefully, because certain concentrations may have specific requirements that others don't. And you don't want to miss out on something just because you missed it or you thought it was the same, that all programs and concentrations were the same. You want to make sure that you take note of those specific um, qualifications or specific requirements for each program, and specifically for your program of choice. Okay. The second step is to make sure that you're, again, very much related to the first step, which is make sure that you're reviewing the application instructions. So the admission requirements is not always, in fact, actually, if we're being 100% honest, the application instructions are not the admission requirements. The admission requirements is just what you like what the check boxes are in order for you to be considered qualified to apply to the program, to be a qualified applicant. Application instructions is literally just like what the application asks for you to do. And you want to make sure that you take all of that and that you're conscious and aware of each instructions, just to make sure that you're filling everything out completely, because you don't want to have any missing materials or missing components in your application, or missing sections. But you also want to learn, about each supplemental item, or make sure that you have each supplemental item down, and to know which actual applications or which materials to actually submit. Okay. So that's the second step. The third step is to make sure that you start your application process early and plan accordingly, so that you can make sure that you submit by the deadline. In keeping with what I mentioned before, I would say the most qualified, and there's no way to know this, but just in my experience working in admissions and working with applications, usually the most qualified and the strongest applicants are not always the ones that have like the highest GPA. It's usually the people that, in all honesty, they gave themselves time to apply to the program. How do I want to put this? Yeah, don't shortchange yourself with time. If the application deadline says December 1st, don't start it on November 15th. Don't start it the week of Thanksgiving. Whether you celebrate or not, if you have the time off or not. Um, I think a lot of people tend to think that, oh, it's my Thanksgiving break. I have a few days. I'm going to do it. And then family and sales pop up and get in the way. And then before you know it, it's I had to do the song in my head. 30 days have September, April, June, and November. It's November 30th, and you're scrambling to get your application complete in all materials that it includes. So don't do that. I would say about at the minimum, at the absolute minimum. This is if you like to live life dangerously. You should be starting your application no less than a month before the deadline. And that's pushing it. I actually wouldn't tell people that. I would tell people, hey, if December 1st is your deadline, try to start your application no later than like the middle of October. Really, you want to give yourself ideally at the minimum 6 weeks to get everything together. That includes your resume. That especially includes your letters of reference and letters of recommendation, because that's an aspect of your application that's not 100% within your control, and therefore you want to make sure that you give yourself enough of a buffer to make sure that you get all that in and that you have a complete application when you submit. Last but not least is you want to make sure that you use our financial aid page so that you're making sure that you're calculating your tuition and looking at all the funding opportunities that are available, and making sure that you can fund your education and take advantage of any opportunities to help you fund your education. Okay. That's for starting your on-campus application. I'm gonna fake pass it to Elise and actually pass it back to Steph this time for starting your online application.
Thank you, Derek. So similarly to Derek, our application is quite similar in how we would approach the process. The only key pieces that I would like to highlight in this space here is review the admissions requirement. Remember, there's no SOFAs, it's just the UC Berkeley graduate application. And lastly, I would say deadlines are slightly different, and the fees and funding page. So take a look at that and review, the FAFSA deadlines, because those things are external and not overseen by our department. So if you do have any questions around that, you can always connect with me. Happy to walk through that information with you as much as I know, but there are going to be certain financial information that sometimes might be outside of our program. So I would definitely recommend exploring that. But for the sake of time, let's get ahead and go to the next slide. So Lori, do you mind taking over the letters of recommendation?
Thank you, Stephanie. Absolutely. So letters of recommendation, this is a big component of your application, and this is an area that I know a lot of students have questions around. So hopefully we can address some of them through our presentation today. So for both of our programs, we do require 3 letters of recommendation, and this should be, we do prefer a combination of both academic and professional references. This also has a lot to do with maybe you've been out of school for a while and you've been working and you're shifting careers, or you're fresh out of an undergrad program. We understand people are stepping into their MPH program, whether it is online or residential, in completely different areas and completely different points in their life. So with that, you will have obviously a different set of combinations related to your references. If you have maybe 2 academic references and 1 professional, that's great. If you have 2 professional references and 1 academic, that's also great. We just want to make sure that you show a glimpse into both sides of your world, both academic and professional. And a big question that sometimes is asked, well, if I am out of an undergrad program and I haven't worked maybe for a number of years, where can I get those professional letters of reference? Maybe you were part part of a volunteer organization. Maybe you were a work study student. You held some other job while you were a student on campus or off campus. These can all be used as professional letters of reference while you're a student or while you're getting your application ready. Some best practices that we recommend for our applicants is that when you are requesting a letter of recommendation, first and foremost, give well advance notice to your recommender that you are asking them for a letter of recommendation. Be polite when you are asking for letters of recommendation, because we do want to see positive letters of recommendation, just reflecting the amazingness that you are and have. And with that, as you're asking for those letters of recommendation, maybe send a copy of your resume or your CV, send copies of your essays that you are submitting for your application, so your statement of purpose and your personal history statement. Explain the program that you're applying for. So explain, I'm applying for a Master's of Public Health program. This is a professional degree program that I am applying for, and give a little bit of key details and points to maybe the specific concentration that you're applying for. So for example, if you're applying to our online Masters of Public Health program in health policy, maybe indicate that you're applying for that program, just so your recommender is aware of which program you're applying for as they're writing out your letter of recommendation. It is totally okay to have a TA and a professor co-write a letter. So if you worked really closely with a TA throughout your time for your bachelor's or a different program, and you would like them to write your letter of recommendation, this is totally okay, and you can have the professor co-sign it. Letters should be written on a formal letterhead and submitted through a professional email. So as you submit your the emails and contact information for your recommenders in your application, be sure to send it to an active email that the recommender readily checks, so that they not only get reminders that they have a letter of recommendation due, but that it's easy for them to submit their letter of recommendation as well. And of course, it is standard practice to waive your right to view your letter of recommendation, and this is a checkbox that you'll have in your application that you'll see. I'm going to turn things back over to Stephanie to go over resume and CV tips.
Thank you. So in terms of the resume or CV, we do require it. And these are common bullet points that we would expect to see on your resume or CV. So just make sure that your educational degrees are here. Most importantly, your employment is current, especially if there's any public health or healthcare experiences. Those are key things to also put. My rule of thumb is what you would share with your employers, we would also like to see. So if there's any specific leadership roles or anything that needs to be a highlight, definitely include in your resume or CV. And many students are coming at different spectrums of work experience. So if you've been in the field, whether it's public health or not, if you've been employed for over 20 years, we tend to say go back within the last decade or so. I think that is sufficient for us. And if there's any information we would need that we don't see, there's a possibility that we could reach out to you, but I would go with most current and most relevant. Elise, I'm going to pass this over to you to cover the essays.
Great, thank you. Yes, so for the sake of time, I am just going to be brief, but please know that all of us here, myself, Stephanie, Lori, Derek, we are really here to support you. So if you have specific questions about how to write your essays, do reach out to us. Key distinctions. So these are two separate essays with two separate prompts. Some schools only require one. Here at UC Berkeley, we do require two. The first, your personal history statement, is really supposed to be personal. It's your journey. It's how you were drawn to public health, your lived experiences, how did this interest spark, and, what is it what skills and lived experiences are you going to bring to your graduate school? What are you going to bring to the classroom? How are you prepared? What lived experiences have prepared you? Things like that. So tell us your story. And I always share that, your essays are so important because the other aspects of your application, your transcripts, your resume, all of these things are sort of fixed, right? They're just a description of facts, things you've done and accomplished. But this is your opportunity to give us a narrative, to tell us about who you are and represent yourself, in your own words. So definitely take this seriously. Your statement of purpose is going to be a little bit more forward thinking. So whereas your personal history statement, again, it's telling us your story, your statement of purpose is really, where do you want to go? Why UC Berkeley? Why a master's of public health? Why is this the right degree to get you where you want to go? What is the impact that you hope to have in the field of public health? So tell us about those aspects, and you can cite different things like, tell us about a class that we offer or a faculty member's research that stood out to you. Is it something about our mission, vision, values that aligns with your personal values? Tell us about why our program and this degree is really the right next step to get you where you want to go. All right, Lori.
Awesome. Thank you so much. So briefly, a big question that I guess asked is, what is a writing sample? What can I use as a writing sample? Some of our MPH, or at least our residential MPH programs, do have a requirement for a writing sample, including our environmental health sciences, health and social behavior, interdisciplinary programs. And this can be a final paper that you've written in the class to demonstrate your academic writing sample. It can be a media article that you may have written for maybe a blog post that you think would be sufficient to show your writing style, a report that you may have written, an undergraduate thesis, a publication. If you've written a grant for a job, if you've written a grant before, that could be an example of writing. These are all great ways for you to not only demonstrate your academic writing level, but also just a different element to your application as you're getting it ready. Whether optional or required, this is a great element to include in your application if you would like to include it. And then I'm going to turn things over to Yesenia to talk a little bit about residential tuition and funding your education.
Thank you, Lori. All right, so here we have the estimated cost of what the residential tuition programs will look like. So for the 11th month program, 11-month MPH program, California residents can expect to pay around $41,485. Non-resident students as well as international students can expect to pay around $53,000 for the 11th-month program. For our 2-year MPH students, California residents would look at paying $71,000 in total for the full 2-year program. Non-resident students would be paying $83,000, and then international would be paying $95,000. Non-resident students can apply for in-state residency in their 2nd year, so they would only have to pay non-resident tuition for year 1, and then year 2 pay California resident fees. For our 2-year master's in MS or MA programs, they're looking at $49,638 for California residents, $64,000 for non-residents, and then $79,000 for international students. These costs are current based on what the estimated cost will be for the 25-26 aid year, and they are subject to change from year to year. Like I mentioned, non-resident students can assume California residency once they establish that in their 2nd year. Also, these fees include the Student Health Insurance Plan, known as SHIP. This year, it's $3,924 per semester. So we're looking at a huge savings. Should you have equivalent level of health insurance already through either a job that you have or a family member, you can waive out of our health insurance plan and have a savings of about $4,000 per semester. Next slide. So ways in which that we can fund our education. I always recommend students to complete the FAFSA or the DREAM Act application to qualify for federal and state loans. Although FAFSAs and DREAM Acts mainly offer grants for undergraduate students, it's always nice to have a loan package so that should you decide to take out a loan, that's already ready for you for the time that you start enrolling. There are also merit and need-based fellowships available to students. There, within the admissions applications are specific questions on funding. It's very important for students to take their time answering those funding questions as they're directly aligned with our in-house fellowship. So again, take your time answering those questions because they are important when determining who can qualify for a fellowship through Berkeley Public Health. There are training grants available for students looking for assistance with paying their tuition costs. There is also on-campus employment like readers, teacher assistants through work study or graduate student instructors or researchers. Definitely take advantage of those opportunities. If you are a graduate student researcher or instructor or any other type of student employment that offer what's known as fee remission, you can look at not having to pay tuition as long as you meet the qualifications for fee remission. There's also off-campus jobs and internships. Our school is located in downtown Berkeley, so there are opportunities for you to work nearby our offices. And then, of course, any external funding. So if you already have a funding source, we can honor that. You just have to submit proof, and then we can apply it to your account. And I will pass it over to Elise.
Thank you. Thank you. So the online MPH program, we have our tuition is based on the number of units you're enrolled in. So it's a per unit tuition. Right now, our per unit tuition rate is $1,552. To complete the total 2-year 7-semester program, it would be 42 units, but you're only paying for the number of units you're enrolled in a given semester, which is usually 6 units. There's a few Berkeley campus fees. Sometimes students ask, why is there a campus fee if it's an online program? And we share that it's because as an online student, you still have access to tons of campus resources, library resources, tutoring. The rec center has a bunch of online options. So those are available to you and your campus fees go toward those things. That brings the total cost of our program to just over $70,000, again, for the full 7 semesters. And our students, they pay for the program in a variety of ways. So one way that our students pay for the program is that they are self-funded. They'll pay the full way out of pocket. Sometimes students are able to do that because our program is part-time and is built for folks who are working full-time while they're in school. So some individuals are able to pay the full cost of the program, because they're working and they're able to cover those fees. Our students are also eligible to apply for federal student aid. There are certain careers or positions that our students may be in that would qualify them for fee payment plans, for public service loan forgiveness. So if you end up going the federal student loan route, we encourage you to explore whether your profession might qualify you for a public service loan forgiveness program. For those who are paying out of pocket, we do also offer fee payment plans, which are options to break down your payments into smaller monthly installments. Also, because our students work full-time, there are many cases where our students' employers will sponsor their education. So we highly encourage you to explore if your employer offers any sort of tuition benefit. And then lastly, we do offer a few scholarships. Most notably this spring, we are offering our Rural Health Innovation Scholarship, which is a full ride scholarship for students who live and work in rural communities.
All right, so as we approach the end of this presentation, there are many ways to get connected with us. We are here to support you. So if you have any residential MPH questions, reach out to sphadmin@berkeley.edu. Lori will be your primary point person to connect with in relation to in-person, residential, on-ground. We have all those terminologies are interchangeable and mean the same thing. So if you're interested in the 100% in-person program, that is your point person. We are also available in the online space to answer your questions in relation to that. So if you are interested in the online MPH program, connect with Elise and I. We can be found through email online.mph@berkeley.edu, and both admissions teams are available for one-on-one Zoom and phone appointments. I'd also love to open this up for questions if anyone has any. So please feel free to ask your questions, and we will be sending out this recording or posting it on our YouTube channel. So give us a few days and we will have it there. But thank you so much for joining us, and I will conclude this presentation in terms of the slides, but open it up for Q&A. And thank you to the team also for presenting as well.